We described the HIV life cycle and the mechanism of action of antiretroviral agents. We recommended DHHS guideline concordant antiretroviral therapy for patients who are treatment naive with HIV-1. Now, given a newly diagnosed HIV patient, ensure adherence to antiretroviral therapy is optimized.
So one thing that's important about HIV drugs is that when there is insufficient drug level in the body, then the virus can actually start replicating in the presence of drug. So because they can actually replicate in the presence of drug, they can actually, because of selective pressure, it can actually select for resistant viruses, and that can lead to treatment failure. So when there is resistant virus, you can suspect either insufficient drug level that led to that resistance, or of course there's also the possibility that that person could have actually received the resistant HIV from someone else. So it's not always due to insufficient drug level. So if someone has resistant HIV, they can actually pass it to someone else. But it's not as common. This is not as common. What's common is that typically you will end up with insufficient drug levels leading to resistance. And there are different reasons for having insufficient drug level. Whether it's the wrong dose, or problems with absorption, or pharmacokinetic differences. So if someone is rapidly clearing it, or if there are drug interactions. We will talk about drug interactions on day 2. But the most important is, adherence is a huge part of this. A lot of the times when there's insufficient drug level, it's because the patient is not taking the drug. Especially since our drugs are actually pretty potent, so it's not common to see suboptimal potency. This was common back in the 1980s and 1990s, but with our current guideline recommended regimen, they're pretty potent. So usually, if you see treatment failure, it's often due to poor adherence. And poor adherence, sometimes it's because of toxicities. Someone is having a side effect. Because of the side effects, they can stop taking it, and so it's important to figure out why they're not taking it. Or sometimes regimen issues. If you have to take 10 pills a day, that becomes a burden. We call that pill burden. Or let's see. Or if they always have to take it on an empty stomach, but they're always eating, for example. Or if they have to take it with food, and they're fasting all the time. Intermittent fasting is it has become a common weight loss practice nowadays. So that could become a problem. So here's some data to show the importance of adherence. So you can see that typically and this was published in 2000. So these numbers will look different with the current treatments, just because our current treatments are more potent. We can see that in this study they showed that like when adherence was less than 20%, failure was more than 80%. So like we talk about, like for example, if you compare it to warfarin treatment and INR goals, if somebody's taking warfarin and they're at INR goal about 60% of the time, they're actually doing pretty good, because that's similar to what the clinical studies did. They usually time in therapeutic window was 55 to 60% of the time. But you can see that the same doesn't apply to HIV. So 70% adherence is actually worthless, because it's gonna lead to 82% failure. So the guideline says adherence of 90 to 100% of the time is actually necessary to make sure that the viral remains undetected. And in reality, adherence may be as low as 50 to 70%. So it's really important educational point to let the patients know that 90 to 100% is extremely important. And as you would suspect, the risk of resistance is lowest in adherent patients. And although over the recent years, ART regimens have become much simpler. So we have one pill once a day dosing available, so to make it really easy for adherence. But suboptimal adherence is still common. So it's extremely important to assess readiness for ART before we actually start treatment. And once we do start treatment, it's important to assess adherence at each clinical visit. So how exactly would you measure adherence? So generally there is no gold standard. There are different ways that you can do to actually measure adherence. Probably the best thing to do is if you measure somebody's RNA level and it's undetectable, that tells you that they're taking their pills. Now, what we typically end up doing is that we actually ask the patients, like when you interview the patient, you say how many times. If you ask open-ended question, you can ask how many times did you miss your pill, instead of asking did you miss any of your pills. However, regardless, the patient's answers typically overestimate adherence. The other tool that you can use is you can actually look at pharmacy records. So if somebody hasn't, if they have a 30-day supply and they haven't actually refilled in 3 months, that gives you a good idea that they're not adherent because they haven't finished their pills yet 3 months later. Here are some factors associated with adherence. So, obviously pill burden is a huge part of it. Also, literacy levels are associated to adherence. So is younger people because they're not used to taking medication, so they may not realize the importance of taking medications. Also, with older age, there are some challenges. So polypharmacy will be the biggest issue with older age, uh, along with, for example, cognitive impairment. So if they're confused, they may not know, if they're, they may not know what they're taking, or they may not remember if they took their pill or not. There's a stigma to go with HIV. So people may, not take their pills just because they don't want people to find out that they're taking HIV pills. And there are some other factors that you can look at. And of course, factors associated with adherence success would be basically the opposite of the previous factors. So pharmacists have a key role in improving adherence in patients. Here are some tools that you can actually use or actually recommend to pharmacists. So pill boxes become important tool, especially if someone has polypharmacy. Pill boxes are a powerful tool in organizing pills, especially if they are taking multiple times a day. And it also helps patients remember if they've taken it. Now, sometimes it becomes unnecessary. So if it's one pill once a day and the patient has nothing else to take, a pill box is not really going to help you. If anything, it might actually become a barrier because they have to carry this big pill box versus just a small bottle. So, pill box is usually useful if there is complex regimen. Pill burden can be resolved by pill boxes. Let's see. Other things that so one problem is if the patient doesn't is forgetful, they don't know, oh, did I take it today or not. One powerful tool they can do is that they can actually use journals. So all you need is a simple notebook next to the bottle. So every time they take the pill, all they have to do is write the date and time. So later in the day, if they say, oh, I don't remember if I took the pill, all they have to do is open the notebook and see if they recorded today's date. With today's watches, you can also set watch alarms. So if somebody takes it every day at 9 p.m., they can actually set an alarm for 9 p.m. to remind them. And of course, if you have smart watches, you can also program it to, there may be apps on the watch that you can actually use to remind the patient to take the pill. Now, if you do identify patients that you think will be non-adherent, the guide actually recommends using either a regimen with dolutegravir or darunavir. And the reason, which I will explain on day 2, is that these two drugs have a high barrier to resistance. So if the patient misses, a few pills here and there, the HIV is less likely to develop resistance against darunavir and dolutegravir. So basically, they're saying if you have concerns of adherence, it's best to start with these two, because it will be less likely for these to develop to select for resistant HIV, leading to treatment failure compared to other regimens. So it's not that it's impossible with these, but it will be less likely compared to other regimens.